Perfect. Good morning, good afternoon, and good evening, everyone, depending on where you're joining us from. Thank you so much for taking the time to be with us today. We really appreciate you joining us and being part of this important conversation. My name is Mande Limbu, Senior Director of Global Advocacy and Partnerships at FP2030, and I'm pleased to welcome you to today's webinar as we launch the Advocacy Blueprint for Family Planning Financing. Before we get started, just a few logistics. For our French-speaking colleagues, interpretation is available, so please select the interpretation option and choose French. We would also love for this to be an interactive discussion, so please introduce yourself in the chat and let us know your name, your organization, and where you're joining us from. Also, feel free to share questions and reflections in the chat throughout the webinar. We have FP2030 colleagues from our regional hubs and partner organizations joining us today who will help respond to questions and engage in the discussion along the way. So why are we here today and why does this matter? Today's webinar comes at an important moment as we convene in the margins of the World Health Assembly. Health financing has been a major focus of conversations taking place in Geneva, with increasing attention on domestic resource mobilization and how countries navigate an evolving financing landscape. Today, we are really pleased to create space to broaden that conversation and bring civil society voices into it. As you all know, civil society has a critical role to play, and this current landscape calls for a new blueprint for civil society action. The Advocacy Blueprint was developed with that in mind. It is intended to be a practical and flexible resource that provides guidance on priority advocacy opportunities for accelerating financing for family planning. I would like to take this opportunity to thank the many partners who contributed to the development of the blueprint. Special thanks to MSI, Health and Rights Education Program, RHSC, UNFPA, and PAI, for sharing tools, resources, and case studies that strengthened the blueprint. We are also deeply grateful to the more than 100 CSO partners who provided feedback and insights during the 2025 ICFP in Bogota. Your perspectives helped ensure that this blueprint is practical and responsive to real countries' needs and experiences. For today's session, my colleague Kim Whipkey, the Senior Manager for Global Advocacy at FP2030, will walk us through the blueprint and highlight key components, practical resources, and how civil society partners can use it in different contexts. Following that, she will have a brief discussion with 3 civil society leaders who will share practical experiences from their own country advocacy work. We'll also highlight additional complementary advocacy resources and tools currently being developed by UNFPA, RHSC, and PAI that can further support financing advocacy efforts going forward. So colleagues, we have a great session planned. So without further ado, it is now my pleasure to invite Dr. Samu Keliso Dube, the Executive Director of FP2030, to share opening reflections and help set the stage for today's discussion. Dr. Samu, over to you.
Thank you, Mande, and good morning, good afternoon, good evening for everyone who is attending this webinar today. I'm really grateful. But Mande, I'm grateful for the partnership that you've just alluded to with RHSC, with MSI, with UNFPA, with PAI, everyone who is really working hard on ensuring that when we are discussing healthcare financing, we discuss family planning financing. When we are discussing development financing, we include family planning financing in there because family planning financing, in essence, is development financing. So colleagues and friends, I hope you're all good wherever you are. So good morning. The important thing here, colleagues, is that we are meeting at a time where there is so much disruption in our sector, the family planning sector, but also the health sector in general. We have seen that our funding for health, funding for sexual and reproductive health and rights has been contracting over the past few years. But what gives me hope and what makes me wake up each morning is that people across the world want to use contraception. And in fact, our data shows that there's been an additional 101 million new users, additional users of modern contraception since 2012 when FP2020 was started. And we have been seeing doubling of contraceptive users in 28 countries. So how do we keep this momentum going? This is where you come in. Because when you are working in civil society, again, the question that I wanted to actually start with is, when did you last pay your taxes? How many of you pay taxes? When you pay your tax, you are interested, you are invested on how that money is spent. And because you are interested and you're working in family planning, you know that we must double down because we need the tools to double down on the progress that we have seen, because 2030 is around the corner. And this is why I'm precisely proud to introduce the Advocacy Blueprint for Family Planning Financing, which, when I looked at it, is a practical, is an action-oriented tool that has been designed for you, civil society organizations, your community representatives, where you work in many countries across the world, to ensure that we can navigate this challenging and very complex financing landscape for family planning and for sexual and reproductive health. For FP2030, this tool specifically represents a renewed focus on sustainable financing. We have been talking about sustainable financing for a long time, but here we are. We want a renewed and sharpened focus so that our new strategy that we've just completed is designed to meet this moment, and we cannot do this without you. Colleagues and friends, this blueprint is not just a wish list. You may look at it at a glimpse and you're like, we've seen this before. But when you double click and you go through the journey I think Kim is going to take us through that journey, you will see that there is a clear identification of priority advocacy areas that will mobilize family planning, from domestic budgets to global financing mechanisms to some of the partners who may be in this room, whether it's GFF, whether it's UNFPA match fund, whether it's some of the innovative financing mechanisms that we are seeing sprout out throughout the world. Because when governments prioritize financing for family planning with the right approaches, progress becomes sustainable and it becomes truly country-led, which is why civil society matters in this conversation. Because when you are working with your members of parliament, when you are working with your ministers of finance, when you are navigating the complex conversations with the ministers of health, progress becomes even visible. Too often, advocates have passion and skills, but they need support to open the right doors at the right time, with the right arguments, with the right tools, and especially when we're talking about investment language. Believe you me, that investment language is not that complex when you get deeper into it. Now, to every civil society partner, every youth advocate, every leader who is in this room, this tool was developed with you in mind, and it is built for you. Your voices have shaped it. And thank you again to my team who have consulted far and beyond to ensure that voices of many people shape this conversation. Your experiences have informed it, and we know that civil society continues and will continue to play a critical role in accelerating progress to family planning. Imagine if we wake up tomorrow and your local clinic, your local hospital actually prioritizes contraception because you are part of the financing conversation. Because the financing landscape has shifted, our commitment has not shifted, because we are clear about what we want to achieve. We are clear about ensuring that contraceptive commodities reach the last mile. We are clear that young people across the world need to have access not only to information, but to life-saving commodities to make clearer and better choices in life. When clinics provide contraception, when young people access reproductive health services, when women can choose if and when to have children, when family planning remains a priority or quietly disappears from the budget altogether, would depend on you, would depend on the actions today, would depend on the collaboration and the partnerships that we are all talking about today. So colleagues, here is to the advocacy blueprint, and we will not stop advocating until every contraceptive is stocked, every healthcare worker is trained, every outreach program can reach rural communities, every young person can access information and services, and those things start with a financing decision. So I'm handing over to you, Kim and Mande, to take us through what you have in store for us. And my fellow panelists, welcome. I'm looking forward to what you have in store for us and collaborating further on this blueprint and ensuring that it reaches those who need to hear about it. Thank you.
Thank you so much, Samuel, for those powerful remarks and for helping frame both the urgency of this moment and the opportunity in front of us. I think one message that really stands out is that our commitment has not changed. And while the financing landscape continues to evolve, there's a real opportunity for stronger advocacy, stronger partnerships, and more coordinated action to ensure family planning remains prioritized and, as you said, sustainably financed. So with that context in mind, I'll hand it over to Kim to take us through the advocacy blueprint. Kim, over to you.
Great. Thank you so much, Made and Samu. And next slide, please, Andy. So following that introduction, I think everyone's excited to see what the advocacy blueprint for family planning financing looks like. And what I love about this tool is that it's simple, it's flexible, and it's user-friendly. It's divided into 3 actionable steps, and at the end, you'll have an advocacy plan to drive progress on specific priority financing approaches in your country. So my colleague is soon going to put a link in the chat to the blueprint so that you can explore it on your own. But for now, let me briefly walk you through the tool. And then, as Mande said, we'll hear from civil society advocates about what blueprint implementation looks like in practice. Next slide, please. Great. So with all of this financing disruption, you might be asking yourself, where do I even begin? The first step is to assess the financing landscape for family planning in your country. The blueprint compiles about 20 questions exploring things like economic context, domestic financing for family planning, other financing sources, and political policy and partner landscape. Most of these questions can be answered through things like desk research and stakeholder conversations. We know that every context is different, so we encourage you to modify or delete questions as needed. And as you'll see on the next slide, if you could advance to the next slide, when you click on one of those numbers or little arrows, a box will open up with a list of suggested questions. So here you can see illustrative questions on domestic financing for family planning, everything from its position in the health budget to commodity security to budget execution. So again, you just click on each one of the circles and a box will open up and you can read through the questions and pick the ones for your context. Next slide, please. So the second step is to dig deeper on financing approaches. This step is really the heart of the blueprint. These 8 financing approaches are highlighted here because of their potential to offer sustainable or catalytic financing for family planning, as well as opportunities for civil society to engage. And we like to refer to it as like a menu of options because no single financing approach is going to be sufficient to secure sustainable financing on its own. And the right combination of approaches will depend on your setting. So these 8 financing approaches include domestic public financing, both the public budget and national health insurance, global financing facility, or the GFF, UNFPA supplies partnership country compacts, private sector, other or innovative financing mechanisms, official development assistance, and U.S. global health assistance, the bilateral agreements. And we've included the bilateral agreements here, not necessarily because they're a major source of financing for family planning, but because they have potential implications for domestic and donor financing. So when you're using the tool, you just click on one of the names and then you'll be taken to a page that has much more information about that specific financing approach. So that's what we're going to do now. We're going to stop sharing the slides and I'm going to share my screen and actually take you through 3 financing approaches. And we're going to start first with domestic public financing and the health insurance. I think most people are quite familiar with the public budget. So we'll skip over that to begin with the next one on the list. So just give me a second as I pull up my screen share. Okay, perfect. So I hope you all can now see my screen. So when you get to the page, you'll immediately see information that advocates want and need about any of the financing approaches. What is it? Why does it matter for advocacy? So in this case, you can see that national health insurance refers to a government-led health financing system that provides health insurance to a national population, and it typically pools funding from sources like general tax revenue, payroll taxes, and more. It matters for advocacy because including family planning and national health insurance has the potential to expand access, and it also draws on a more predictable and sustainable source of financing for family planning. When you scroll down on the page, you'll also see additional background information to consider when determining whether or not to prioritize this approach for your advocacy. You know, financing mechanisms are really complex. Nothing is going to be perfect. There will be some positives, there'll be some potential pitfalls. So, for example, with something like integrating family planning into national health insurance, the advocacy doesn't even just stop with getting it into that health package. You have to think about things like which contraceptives are covered, under the health insurance? How will they be reimbursed or paid for under that scheme, etc. So scrolling down, we come to a section on advocacy entry points. This is the part that's like, how do I take action on this? And what you see here are examples of what we call advocacy asks. They drive progress against this financing approach. And then you pick the ones that resonate most with your situation. So for example, if, let's say, the health benefits package is being revisited and revised in your country, you may determine that more evidence is needed. You might need to support something like a local budget impact analysis to determine whether there are cost savings, for example, associated with adding contraceptive methods to that package. And then the other section I want to draw your attention to is this advocacy case study section. So how have others done this? And then in this webinar, we have speakers who will describe the case studies that we feature here, starting with how CSO advocacy was really pivotal to the inclusion of family planning in Ghana's national health insurance scheme. So further scrolling on the page, you'll see you come back to this menu, and this is how you navigate around the different financing approaches. So next, we're going to turn to the Global Financing Facility. Okay. So I like to joke that, we're 10 years in and we're still trying to figure out sometimes what the GFF is and how this mechanism works in practice. So this is where you can find that information. GFF is a country-led financing approach for reproductive, maternal, newborn, child, adolescent health and nutrition, hosted by the World Bank. And it matters for advocacy because it has a catalytic effect. Modest GFF grants not only help mobilize domestic resources for areas such as family planning, but they also help generate additional financing through the World Bank, through IDA loans, for example, and other external sources. And scrolling down here, we have, again, additional background information that can be useful as you consider this approach. I'm just going to call two of these to attention. So first, GFF has a new strategy, so we encourage you to take a look at that and how it increases attention to the issues that we care about. And then also, we're just getting some emerging details now around this new Sustainable Commodity Access Program, or SCAP. So this is a new GFF commodity financing mechanism for family planning and M&H commodities that could be a real game changer for family planning. So we're going to continue to provide updates here. We ask you to watch this space. Okay, so I'm going to skip down again to advocacy entry points. So we know that the GFF has a lot going on. So we're trying to take away some of the guesswork with where advocates can have impact with GFF processes. So for example, we have these illustrative engagement opportunities around multi-stakeholder country platform, investment case development, and then investment case prioritization. This piece here on the financing prioritization is so critical for us because I think there's more our community can do to figure out how to channel more of those World Bank IDA loans specifically to family planning. And then again, you can see we have a case study that we'll dig into in just a moment. So I'm coming back to this menu and we'll briefly look at UNFPA. Okay, so as many of you know, UNFPA country compacts are really taking off and they're generating significant momentum and financing for family planning. And we're really excited because the blueprint has up-to-date information about these compacts because right now they're going through a bit of an evolution and a change with the rapid refresh. So what you see here is current information. So what are the compacts? They're 3 to 5 year MOUs between UNFPA and governments that outline a mutual program for financing sexual and reproductive health commodities. They also outline a government's financing commitment, which is sometimes referred to Annex A for those who have been following this space. And then why do they matter for advocacy? Several reasons. They help solidify government commitment to SRH commodity financing. They help put governments on a pathway to country ownership, particularly around procurement. And they help incentivize increased domestic expenditure on family planning and other SRH commodities through the match fund. So down here, you can see a bit more about the match fund, including how it's continuing to evolve to meet the moment. And as we scroll down to the advocacy entry points, I do just want to say that honestly, I think CSOs have sometimes struggled to find meaningful entry points with the compacts. And I think we're all feeling really hopeful with the redesign of the compacts. There'll be more opportunities for CSOs to be engaging and consulted in the negotiations. So what you see here are some examples of how you can get inspiration to engage, influence, and inform in the UNFPA compact processes. So again, this is a very rapid walkthrough, and we encourage you to spend more time looking through the tool on your own. But with that, I'm going to take us back to the slide deck so we can kind of finish out a final look at the tool before we have a conversation with our speakers. So Andy, I'm going to stop sharing my screen, and if you could just pull up the slides again, that would be great. So as she's doing that, I'll just say that the third and final step is to develop your financing advocacy strategy and implementation plan. And the sub-steps that you see here should look familiar to most advocates. These are part of the SMART advocacy approach. But what the blueprint does is it adds a financing perspective to each one of these sub-steps. So you would click on 1, 2, 3, and 4, the box expands, and then you get more information and guidance on how to complete each one of these sub-steps. The most important one, I think, is number 1. It's really identifying that financing approach or approaches that you'll prioritize for your context and your advocacy. And the blueprint includes a checklist to help you determine, okay, now that I know my financing landscape, I know more about these financing approaches, which one or ones make the most sense for me to prioritize in my setting. And then the last and final thing I'd like to mention about the blueprint is that it's a living document. So we encourage you to reach out to us at FP2030 if you have insights, case study examples, information to add, because this is also your toolkit. So with that, we're now going to turn to the how. Like, how do we implement this blueprint? What does it actually look like in practice to successfully advocate on these different approaches? So we're going to hear from 3 different CSO speakers, and then we're going to have a little bit of time for question and answers all together before closing out. And then I want to remind you all to please put your questions for myself or our CSO speakers in the chat, and we'll pull some of those out for full plenary. Okay, so first, it's my pleasure to introduce Sarah Shaw, who's the Associate Director of Advocacy with MSI Reproductive Choices. So, Sarah, a few years ago, thanks in part to the advocacy of MSI and other partners, we celebrated the inclusion of family planning in Ghana's national health insurance scheme. So, in 4 minutes or less, can you tell us more about why this was a critical opportunity for family planning from a health financing perspective? What advocacy activities really move the needle to make this change happen? And how are you all continuing to monitor implementation and rollout today? So, over to you.
Great, thanks, Kim, and hi everybody. It's really great to be here. So the Ghana National Health Insurance Scheme, it now covers about 68% of the population, and it also reaches a really diverse range of socioeconomic groups. There's premium paying formal and informal workers, and then there's also heavily subsidised or completely exempt vulnerable groups, which include children, pregnant women, the elderly, and extremely low income. So, it's the government's main mechanism for achieving UHC. And because of the diverse reach of the scheme, the potential for reaching and fulfilling unmet need for family planning was considerable. But family planning was always included in the scheme since its inception in 2004. But it only funded the service, which meant if the client then wanted to take up a method, they then had to pay out of pocket. And around about 2018, which is probably when the advocacy really, really started to gain momentum, unmet need for family planning was around 30%. So, it's a real not leveraging the scheme for family planning access was a real missed opportunity. So the work sort of started probably around about 2015, 2016 with the African Health's Market for Equity project, which was funded by the Gates Foundation and FCDO. And this was a multi-country project, but it really helped open up conversations around the importance of including family planning and private providers in UHC. And but it also surfaced concerns around the cost of doing so, and highlighted that was a real barrier. So on the back of the momentum gain generated by that project, Ghana Health Service actually reached out to MSI and said, well, would we take on a role convening stakeholders around a conversation around this? And we also reached out to Population Council, who led the research pilot. It became clear that, we knew that family planning was obviously a great value for money investment for the scheme, but we needed the evidence base to help make the case. So Population Council were really key with that. And in terms of the advocacy, we used a range of tactics. I mean, the first was the socialization and the ownership phase. And this really took about 18 months. And this was where we just went round and had lots of consultations with key stakeholders in the project. So the National Health Insurance Authority, Ghana Health Service, UNFPA, USAID. Similarly, we had similar conversations at district level with the DHOs, district health management teams, key opinion leaders, CSOs as well, who would help support the implementation at district level. Once we'd done that phase, we then moved on to designing the governance structure for the pilot and for the advocacy. And this was really the governance structure was a really great opportunity to involve the influencers and decision makers as well as the influencers. So a high-level pilot steering committee was formed. This group was responsible for steering and guiding the scientific rigor of the pilot. And, this included representation from the Ministry of Health, Ghana Health Service. It was actually chaired by the chairman of the Parliamentary Select Committee on Health. So already, the parliamentary decision makers were brought into the process and felt ownership. And then there was also a technical working group. And this was really where the implementers and civil society had a greater role. And this was where this group was responsible for the day-to-day implementation of the pilot. But again, involving all these different stakeholders right from the outset meant that they were already invested and wanted to make this a success. And then when it came to the pilot itself, the purpose of the pilot was to demonstrate that removing out-of-pocket barriers would increase the uptake of contraception. Care was taken to ensure that supply and demand side barriers were removed. So in the seven, I think it was 7 districts that were selected to be part of the pilot, we ensured that there was commodities in the facilities. We ensured that there were trained providers, and the demand generation also happened as well. So, it was then quite a neutral space. All the health system barriers were removed. The pilot was a great success, and there's actually a link to the findings in the toolkit. But headline findings: every dollar invested in contraception saved $4 in direct healthcare costs. We saw that over time as well, women were more likely to select LARCs because prior to the pilot, the initial high out-of-pocket cost was a barrier, and this was impacting women's individual method choice. Once the research had been done, there was, it was launched, it was socialized, and it was really used for the advocacy with all the different influencers and decision makers. And at the end of 2021, it was announced that family planning would be included in the scheme. We have seen reductions in unmet need since then, but there are still challenges. The rollout is not universal across facilities and districts, and clients are still incurring out-of-pocket costs for consumables like cotton wool, plasters, and so on. The scheme still does not include short-term methods, and often there's supply constraints, there's frequent commodity stockouts of LARCs, and sometimes there's shortages of trained providers as well. The NHIS is not always very quick at reimbursing facilities, which, is a deterrent to provide new providers willing to sign up to the scheme. And then in terms of next steps, later in the year, MSI is planning an impact assessment, and that's really going to inform future advocacy and accountability efforts around the scheme to see if we can maybe convene civil society around some advocacy to help iron out some of these challenges. Thank you.
Thank you, Sarah. I feel like we could spend hours talking about this one experience, but I appreciate those headlines, especially, again, hearing how CSOs are one important stakeholder group, but it takes a wider technical group and steering committee to move this work forward, and then the importance of that evidence generation. So I want to remind people, please put your questions in the chat because we do have a little bit of time where we can take those as a full group. So next, I'd like to introduce my colleague, Yusuf Nuhu, who's the Advocacy and Accountability and Partnerships Manager with FP2030's Northwest and Central Africa Regional Hub. So Yusuf, we know that in Nigeria, under the Smart Advocacy Initiative supported by UNFPA, the government, and civil society partners, CSO advocacy really helped contribute to the recent release of $4 million in domestic funding for contraceptive procurement. And this further unlocked the UNFPA match fund. So from your experience, what is the added value of CSOs in advocacy for domestic resource mobilization and fulfillment of the compact commitments? So again, please stick to 4 minutes or less. Over to you.
Okay, thank you very much, Kim. Hello, everyone, from wherever you're joining. In my experience, I think civil society bring critical added value because they operate at the intersection of the community, government accountability, as well as policy influence in terms of what they bring to the table, the ability to translate high-level commitments to sustained public and political demand so that commitments do not end just on paper. Additionally, civil society, close that accountability gap by playing the tracking and accountability role. Also, civil society organizations, bring and highlight the voices of the community and ensure equity so that it's not about increasing resources, but directing resources to where they are needed most. Also, civil society organizations, ensure that community continuity, and institutional memory, as well as advocacy for long-term outcomes, because governments come and go, but the civil society organizations remain and ensure that family planning remains visible in the policy agenda. Lastly, is around coalition building. Working with diverse stakeholders, including private sector, media, among others, around a shared financing agenda. Now, if you take Nigeria as an example with the UNFPA Compact Agreement, I think the compact presented a very unique opportunity for domestic resource mobilization and family planning financing, vis-a-vis a country with more than 40 million women of reproductive health, increasing family planning services demand, but with persistent financing challenges. So signing up was a great step by the government to ensure more public resources are put on the table and in the commodities basket. However, there remains those financing structural and institutional challenges, and as such, civil society organizations step in to provide an advocacy approach that can stem some of those challenges. And with that and support from UNFPA in 2023, they were brought together alongside other family planning stakeholders around building an advocacy approach towards fulfillment of the UNFPA Compact Agreement. Two objectives were set. One around the release of $4 million, which will go a long way in fulfilling the commitment, but also unlocking the match fund, and then subsequently inclusion of around $12 million in the national budget. At the end of the National Smart Advocacy Capacity Building, an advocacy core team was set up, and this core team engaged different stakeholders at different levels. For example, they had ministerial meetings with the Ministry of Health as well as the Ministry of Finance, highlighting the importance of release of family planning commodities funds, as well as what the country gets to benefit from the UNFPA match fund. There was also engagement with high-level influencers like the special advisor to the President on Health, who is a family planning advocate herself. And she facilitated, conversation around putting in adequate funding for family planning in the national budget. Around the coalition, there was also media roundtables that were held with the media members of the advocacy core team leading, which kept family planning and domestic resource mobilization, more visible in the policy agenda. In terms of results, by the end of 2024, the government released that $4 million, which for the first time, was a step forward after so many years of, persistent challenges. And, that was done through UNFPA, and it helped unlock the match fund. But importantly, also in subsequent budget, additional increased resources in the national budget was also witnessed. Importantly, advocacy was also taken to subnational level, where a lot of activities are done. And from 5 states, there was a release of around $135,000 for family planning, which also further unlocked more than $200,000 in the match fund. Of course, there remains challenges, delays in disbursements and utilization, alongside other supply chain constraints. But this underscores the need for continuous monitoring, advocacy, and accountability efforts across all levels to ensure that financing continues to remain high on the agenda of government for family planning. In
Thanks,
essence,
Yusuf. I'm so sorry. I am going to have to cut in just because we're short on time. But thank you so much for those really great contributions. And I love how you also brought in the subnational perspective because that is where the action really happens. I've heard you say that before. Again, so sorry to have to cut you off, but just want to be respectful of time. So with that, we're just going to turn now to our last speaker in this part, which is Maziko Matemba, who's the Executive Director with the Health and Rights Education Program in Malawi. We're going to talk a little bit about GFF. So over the years, Maziko, we know that CSOs in Malawi have done a really incredible job advocating to inform GFF investment cases and unlock that financing for women's, adolescents, and children's health. Could you tell us some lessons that you've learned along the way and how to navigate these GFF processes and really channel those funds to family planning specifically? And if there are things we should be keeping in mind now as GFF rolls out its new strategy, I think we're all ears. So again, please stick to 4 minutes or less because we are running a bit behind on time. Thank you so much.
Thank you so much, Kim. And also let me join my previous speaker, Sarah, but also Yusuf. Yes, indeed, Malawi, in terms of the resources of financing for family planning, civil society played a greater role in terms of making sure that all funding platforms which are available in country and even globally, they're also focusing on family planning. For example, we have worked with FP2030 in terms of their coordination, but we are aware that we cannot be talking about family planning without resources. So civil society in Malawi over time, we have worked and navigated. And GFF, when Malawi joined GFF in 2017, we, civil society, were in forefront because we knew that family planning commodities are critical. So over time, we have seen, even in our case study, that family planning, we didn't have a budget previously, and the budget was donor funded. So democratic civil society played a great role. And when GFF came with a small grant support to civil society and the youth, with BI, but also other civil society like Waki Health, through the JLA and others, we much focuses on family planning because Malawi 2063 agenda focuses more in its 10-year plan that we need to focus on family planning. So yes, indeed, we have navigated, and Malawi is one of the key countries which managed to increase family planning budget, but also the overall health budget. But also Malawi has progressed with support from other partners like the Global Fund, which I think we're aware that the African Union at the moment is one of the key platforms for increasing domestic sources for health. So as civil society, but also as one of the civil society actors in the country, a local civil society, we navigated working with government and other key stakeholders to make sure that these resources are targeted more especially in family planning. As you know, Malawi is one of the countries with high teenage pregnancies, and most of the young girls and adolescents are not much protected in terms of their health. So we also want to thank FP2030, Dr. Tube. We have worked with Mandy Lube, we have worked with her before, Kim and others, which are very jealous of making sure that they empower local civil society. So local civil society in Malawi and the youth are more empowered now to advocate for family planning, and we are hoping that this will increase with the coming in of the new GFF strategy, which also we contributed so that it targets what it matters most. So family planning becomes important, and one of the key words of action plan is to make sure that the community of practice we have developed in the country by empowering youth, the adolescents, but also the civil society should continue with regular support from our development partners because the work need to be done, and we are not yet done. So we are hoping with the new GFF strategy, but also other funding mechanisms, we hope that the youth and civil society capacity will be enhanced.
Great. Thank you so much for sharing those insights, Maziko. And you were perfectly on time, which we very much appreciate that as well. So we are running a little behind on time, but we do have an opportunity to answer a few questions that have come in. First, I'm just going to quickly address a question that Beth Schlachter put in the chat, which is around the GFF and specifically, how will we evaluate the long-term cost of using those IDA loans for contraceptive procurement? So right off the bat, I want to say that the SCAP, or that Sustainable Commodity Access Program mechanism, is still under design, and we're still waiting for more information. What we understand at this point is that those IDA loans, which are considered government on-budget loans, can actually be used to help fulfill some of the co-financing requirements around this mechanism. So it will be something to watch and something that we'll continue to update and strategize on. And then I did just want to ask Sarah Shaw to respond quickly to one question that's come in for you, which is, what do you think of adolescent and youth participation as beneficiaries in the health insurance schemes? In most cases, household members are considered to be the beneficiaries of the schemes. If you could just say a bit more about how adolescent and youth, I think, have been treated under the National Health Insurance Scheme in Ghana. If you happen to know that, that would be great. So just in a minute or two, Sarah, if you could answer that. Thanks so much. You have to come off mute.
Yeah, sure.
Perfect.
Do you want me to answer it now, Kim, or in a minute?
Yes, please. Go right ahead. Yeah.
That's a really good question. And to be honest, I don't know, but is what I can do is, if you put your email in the chat or send it to the organisers, I can go back to our Ghana team and get a little bit more information for you. But I do appreciate that for adolescents, when often the health insurance policy is in the parents or the head of the household's name, that this does pose challenges for adolescent access under health insurance.
Thanks, Sarah. We really appreciate that. I think in the interest of time, given that there aren't many further questions and some of them have an interest in the chat, we can wrap up this section, but do continue to put questions in the chat. We have our speakers and our wider FP2030 network who are on hand to help address and answer questions in the chat. So put them in. But with that, I want to turn it back over to my colleague, Mande, who will just run us through a very, very quick preview of upcoming additional advocacy tools. So over to you, Mande.
Thank you so much, Kim, for walking us through the blueprint and highlighting the practical resources and opportunities it offers. And thanks to all our three speakers for your valuable perspectives on the advocacy approaches, what has worked in your context, and some of the lessons you've shared today. Great examples from Ghana, Nigeria, and Malawi. So I think one of the key takeaways from both the discussion and a few questions that we've received, and from Samu's opening remarks, we heard we heard is that there is no one size fits all approach to advocacy. Different contexts require different strategies, tools, and entry points. And that is why we wanted today's conversation to go beyond this single resource. This blueprint is part of a broader set of resources and tools available to support advocacy efforts around family planning financing. So for the next part of our session, we wanted to briefly spotlight a few additional resources that are being developed by partners that complement the blueprint and can help strengthen advocacy efforts in different ways. So to help us do that, we are pleased to have colleagues from UNFPA, RHSC, and PAI join us today. Jan Lacayo, Senior Family Planning Advisor at UNFPA, will briefly share UNFPA's DRM Advocacy and Communications Toolkit. Sarah Webb, Director of Advocacy Market Development and Financing at RHSC, will introduce the Comprehensive Financing Tool, and Fernando de la Torre Gorais, Program Manager for Policy and Advocacy at PAI, will present PAI's Political Economy Analysis for Family Planning Tool. So Jan, Sarah, and Fernando, if you could briefly share what your tool is, how it can support CSO advocacy, and where it can be accessed or when it will be available. Over to you, starting with Jan, and then Sarah, and then Fernando.
Yeah, good morning, colleagues, and thank you, and good afternoon as well. Thank you, Mende, for the introduction. It's a pleasure to join you, FP2030, and fellow advocates on the virtual silence of the World Health Assembly. So I'm really, and truly excited to be here with you, launching this very needed and useful advocacy blueprint. I would like to echo Dr. Simon's words and highlight a sense of urgency given the current context we are. And we have no option than to work on Harambee, which means all together or together as one in Swahili, quite popular motto here in Kenya, where I'm based. So to meet these challenges, UNFPA has developed a new technical and programmatic guidance note on domestic resource mobilization, alongside its companion advocacy and communications toolkit. So this framework pretty much translates our vision on shifting from funding to sustainable country-owned financing into concrete actionable steps. This new package moves beyond high-level theory, and this is the beauty of it, actually, to give UNFPA country offices, civil society organizations, and key partners the operational tools they need to influence national budgets. So in short terms, and in a nutshell, because it's quite comprehensive, it's a really comprehensive tool that I believe it's like 80 pages long and includes some annexes as well. This tool, what it does, it provides a stepwise guidance to strategically engage at all 4 stages of the public financial management process, from the formulation, allocation, execution to monitoring. It also translates complex demographic and health data into rigorous economic investment cases that resonate directly with Ministry of Finance and other key partners. And also, by utilizing accountability frameworks like the PIES Common Framework, we equip CSOs and youth lead groups to track actual expenditures and use facility-level stockpile data as a powerful political tool to hold governments accountable to their co-financing commitments. So this DRM guidance note comes with an advocacy and communications toolkit, as I mentioned. And this tool includes a set of, this toolkit includes a set of tools and resources to assist UNFPA and partners to conduct effective advocacy for domestic resource mobilization on SRHR in general. It is particularly tailored to reproductive health commodities in the context of the UNFPA Supplies Partnership Program. So this also happens in line with the budgetary cycle process, identifying the different entry points we have, as in considering also different roles each organization and partners have. So, but what truly set this resource apart, and this is the exciting part I would like to share with you, is that it leverages AI for strategic advocacy. This is quite interesting, right? So yes, this, I believe, is a game changer. We have built a dynamic AI prompt library that is contextualized for each phase of the domestic resource mobilization advocacy process, specifically optimized for tools like Gemini in Google Drive, but adaptable to other AI large language models, like, depending on which one you use. It can be used with ChatGPT, OpenAI, Anthropic, etc. So instead of digging through static PDFs, what this features does is that transforms the toolkit into an active strategic assistant for our daily work. We recognize that many of our country offices, colleagues, partners, we're surrounded, we're not financiers, we're not PhDs in health economics. We sometimes don't understand some of these basic concepts, and it's really hard for us to engage in these processes. And yes, we have a comprehensive tool and guidance note that has 80 pages and probably like a repository with more than 20,000 pages of economic concepts and financing, which might be extremely hard for many of our colleagues in the field to have access and find exactly what they want. So what we're trying to do with this AI prompt library is to facilitate that process. So you don't need to be, a financier. You just, go through this AI strategic assistant, and you can instantly, for instance, rapidly identify target tools across multiple documents for specific audiences like parliamentarians or perhaps ministries of finance. Or for example, it can instantly generate a localized budget formulation checklist tailored to specific national public financial constraints. So the options are quite extensive, and you can find, depending on the context you are and the needs you have, different prompts that can respond to your needs, and you can, contextualize these prompts based on your country or your role. It also can easily draft like tailor high impact pitches or memos explaining financial levels like the UNFPA match fund, or what just mentioned that the new SCAP financing incentive, and how to leverage these tools and develop or draft advocacy messages around that. So by pairing rigorous health financing strategy with next generation AI technology, we can definitely work smarter, move faster, and turn financial blueprints into fully executed national budgets. So thank you, FP2030 Partnership, for this incredible mass on the blueprint on DRM, and I look forward to working alongside all of you to accelerate sustainable financing for family planning. Just mentioned the toolkit and the guidance note on DRM is not ready. We're going to the publication approval within UNFPA. We can be a little bit cumbersome, but we trust that we will have that comprehensive tool very soon. Thank you, Mande. Over to you.
Thank you so much, Jan. Over to you, Sarah.
Yeah, thank you so much, Mande, and thank you, Jan. So I'm excited to share about a tool that the Reproductive Health Supplies Coalition is developing in partnership with a range of other organizations, many of whom I see on the call today. And so the Comprehensive Financing Tool is a financing resource that we are developing to create access to critical information for evidence-informed decision-making that can be used by different country-level decision makers. We're specifically thinking about ministries of health and finance, and also recognize the critical role that advocates and CSOs play in ensuring that ministries of health and finance have the information that they need to make informed decisions about funding reproductive health. And so the Comprehensive Financing Tool has 3 different sections. The first one is aggregating all of the different global financing and co-financing mechanisms that can be used to fund reproductive health commodities. And so that cuts across family planning, maternal health, safe abortion, menstrual health, and really bringing together all of the different eligibility requirements, a breakdown of the different commodities that each of those mechanisms fund, information on how best to stack these different mechanisms to get the greatest return on investment, and providing guidance to countries who are trying to use different mechanisms in different ways. The second part of the tool is focused more on the domestic space, recognizing that countries are being tasked with funding more and more of their health systems, and that financing for reproductive health doesn't happen in a vacuum. It happens in a much bigger health systems context. And so in the second part of the tool, we're providing guidance around different innovative financing approaches and thinking about some of the preconditions or the health systems characteristics that might need to be in place for different approaches to be successful. And in that component of the tool, we're thinking about this in 2 ways. The first is how to actually increase the amount of revenue that governments are able to spend on health financing, and in this case, reproductive health supplies financing, as well as thinking about opportunities for improved efficiency, looking at things like public financial management and making the system itself more efficient so that more of those resources can go towards reproductive health. And then the third and final piece that links very nicely with the blueprint, as well as the resources that we've talked about today, is a section that aggregates all of the different advocacy materials, including messaging around return on investment of investing in reproductive health supplies, to equip advocates and civil society partners with messages around the importance of investing in reproductive health, not just because it's the right thing to do, but because it actually saves the health system money, and that money can be used elsewhere within the health system. So we will be making this tool available in November of this year, but we plan to release different components of the tool earlier, knowing that there's a lot of demand and interest in this topic right now. And Mande, I will hand it back to you. Thank you.
Thank you so much, Sarah. We're looking forward to the toolkit. Fernando, we are running out of time, but I hope people can stay for about 5 more minutes. Thanks.
Thank you, Mande, and thank you to FP2030 for the opportunity to speak today. I'm very excited to be here. So at PI, we started noticing that there are still not many tools or resources that really connect HRHR with the political economy analysis, or PA. And honestly, that is quite surprising because so much of the work we do in SRHR is shaped by politics, by power dynamics, social norms, and many other institutional interests. So that realization is what led us to develop this PA guide for SRHR civil society organizations. And the main idea behind this guide is simple, right? HRA challenges are not only technical or health issues, they are also deeply political. Policies, let's think about policies around contraception, abortion, sexuality education, maternal health, and many others are influenced not only by evidence, but also at the end by power, beliefs, culture, and political priorities. And too often we see, and this happens everywhere, that we really see good policies or strong evidence that fail to translate into actual change because advocacy efforts don't really take into account the political realities behind decision making. So you can have the right data, the strong recommendations, and even great laws on paper, supportive laws of HRHR, but implementation at the end gets stuck. And that's usually because there are other dynamics at play, right? The political interests of political parties, of politicians, institutional resistance, social stigma, or the fear of backlash by conservative groups. So one of the guides of this guide that we just been developing is to help CSOs move beyond asking only what is the technical solution, right? And instead ask questions like, why does this problem continue to exist? I mean, who's benefiting from this status quo? What are the incentives that decision makers have in order to achieve certain policies? And what kind of change is actually realistic in a particular context? So this guide combines, what we're doing is combining the traditional political economy analysis with other approaches, such as behavioral science and adaptive advocacy approaches. So in practice, this means that it looks not only at laws or policies or institutions, but also at human behavior. I mean, let's think about social norms, fears, values, incentives, and perceptions by a wide range of stakeholders. And we also want this guide to feel more practical and accessible, not really academic, because it could potentially be like that. So it includes tools that organizations can actually use in their day-to-day advocacy work. For example, it can help organizations analyze HRHR challenges at different levels, from national politics or policy environments, health systems barriers, or providers' behavior. And it also will introduce organizations to help understand where reforms are getting stuck, whether it could be at the agenda setting, at the initial phases of a policy development, the policy approval, financing, or the implementation towards the end. And I think one of the most important points is that this guide is really about helping advocates think more politically and adapt strategically. So political context, we know that change constantly, especially right now, and advocacy approaches need to evolve with them. So sometimes the challenge is not necessarily changing the laws, but improving implementation. It's maybe reframing the issue so it will resonate with decision makers. And it could be also like to strengthen and build some more alliances with actors that we may not traditionally work with in the SRHR sphere. So at the end of the day, one of the most important messages of this guide is that evidence is not alone, it's usually not enough. And if we really want a sustainable progress, especially in a very challenging context like right now in SRHR, we also need to understand the power dynamics, the incentives, the institutions with whom we're going to be working with, and the behavior. And to use this will help us just be more flexible and to develop more effective advocacy strategies. So we plan to launch this guide in the coming months, and looking forward to working with all of you with this. Thank you.
Thank you to UNFPA, RHSC, and PAI. We look forward to using these important resources once they're finalized. So as we close our discussion today, I want to say a huge thank you to all of our speakers, partners, and everyone who joined us today. Thank you for your active participation and engagement throughout today's discussion. I want to end with one important reminder. The Advocacy Blueprint we launched today is intended to be a living resource. We will continue strengthening and updating it as new information emerges. For example, on the new SCAP mechanism, we'll be sharing the link in the recording. I see a lot of people asking for the presentation, the recording, so we'll share that as soon as possible. And as Kim said, we want this tool to reflect real experiences from the field. So we encourage you to continue sharing case studies and examples with us from your own work, so we can keep learning from one another and continue building a stronger collective resource. We are also pleased to share that the blueprint will be translated into French in the coming months. So that will help us ensure broader accessibility and reach. We really, really hope this blueprint becomes one more tool in your hands to help drive change. So thank you again for joining us today, and we look forward to continuing this journey together. Have a wonderful rest of your day. Thank you. Bye-bye.
Thanks, everybody.